Hey, you guys, welcome to the very first episode of The Hype, where we are going to be bringing you updates on Mississippi cannabis and things going on in the cannabis world on a weekly show. We'll bring on different guests at different times to talk about different issues and the things that you need to know and really give you an update on all things cannabis. We have some great people that are really working on the network, some great producers, so it's really going to be a fun time, and we'll be here every week to kind of give you guys the hype and let you guys know what's up. This week, Zach actually, he's a member of our group. We are the 74, and he gave a wonderful update on kind of the things that we're expecting over the next week or so. Hey, Zach, can you give the hype show an update as well?
Well, there's some death happening to a puppy in my house right now. It seems that the cat just found the new puppy. Y'all have
no!
There's a pig dying.
Life with a new puppy. We just got a new Yorkie that's 7 weeks old, and we have a cat that they're trying to figure out who's boss, and apparently the puppy is boss. So anyway, getting back to what you had asked me, this week actually got some word from Mr. Blackwell that they have pretty much finalized their bill. They've got to go through Monday and finalize everything up. And he said that he was very hopeful and very optimistic that the lieutenant governor and the speaker of the house would be able to ask our governor for our session. We've heard from countless, I say countless, it's been over 24 legislators that are all hearing the same thing. So it's pretty much, I think we're at go time, and so does Mr. Blackwell. So hopefully sometime next week, we'll be getting official statements that we can actually put out on the internet, and actually hold.
I hope so.
I really think it's coming. And, we have been contacting and asking, and as you guys know, we were struck down in May. So it's been over 4 months, and a little over a month that we should have already had a program with stores open and doing business. So every day that goes by is another day people in Mississippi are going without a program that they voted overwhelmingly for, and that patients, truly and desperately need in this state. So I think that the urgency is there for our legislators. They've all been working hard. They're all tired. They're all ready to put this baby to bed, so to speak. That's what all of them are saying. They've been wanting to get in for months, but with our governor, he is a fiscal conservative, and he's going to look at budgets first, which is, to me, it's a double-edged sword. You can look at it as trying to save some people some money, and other people will look at it as, we have a surplus and we need to get this done. It's what the people want. The legislators have said that the governor's for calling the session. He just wants to make sure that when they call the session, they get in there, get it done, and get out, and it not cost, hundreds of thousands of dollars to the state. So with that being said, all of the legislators that we've talked to in the last day or two have all said the ball's rolling, and things are in motion, and it's looking like we should be able to see an official statement sometime next week.
So okay,
man, that is incredible.
One of the things that you keep hearing over and over again, and one of the things that it kind of needs to be addressed is, where do you go from here? As you wait, and as you all contemplate when this could potentially happen, is what could we be doing at this moment? And so earlier today, I noticed that Bethany had put up a poll to ask the people what it is that their priorities are, and what they really want to push for in this bill. Because as this progresses, and as they all start negotiating back and forth, you'll start getting somewhat of a consensus of what each individual wants. What are you going to fight for? What's going to be your priority? Because we don't know what it's going to say, and we don't know what that we're going to hate. So what do you think is going to be, really, if you could pick your top 3 things, because
it took me a good 5 minutes to answer that poll question, and I'm just going to be honest with you, because so many of those options are so important to me. So to really choose and prioritize what are my top, because at first I selected, I think, 5 things, and I was like, that's not reasonable. It's absolutely unreasonable. I need to narrow this down a little bit. and try to really get, like you said, to the top three things that were super important to me. And it's tough, but I want people to realize that this is what it's going to take to change things. It's not just going to be this bill and then we're finished. Yes, we have a victory. Yes, there's reason to celebrate, but we're going to keep working until this program is exactly what the patients of this state need. Period. Full stop. That's it.
Right. And that was one of the things several legislators, Bethany and I talked to a bunch of them together in conference call, because two heads are always better than one when you're speaking to somebody. And a lot of times legislators will call one of their other legislator buddies to get on the phone with us, and we all brainstorm. And they've all asked, because none of them have actually seen the bill yet either. So
right.
they're asking us our input on what is absolutely important and that they should not give in on negotiating for when they do go into session. And with the poll Bethany put up, every option she put up is very important. But as you ask different people, depending on what part of the industry they're in, whether they are wanting to be in business or a patient, caregiver, or just a supporter, everybody is going to have different things that is important to them. And from what we're hearing and what we have done over the last few months is we have pushed all of those issues with Mr. Blackwell and explained why they were so important. Like I'm saying, we haven't seen the bill, and I'm going to take the gentleman at his word, because when we first met, he and I didn't get along very much, but over the last few months, we've learned to work together, and I have learned to respect the man. He's doing his due diligence, and when he has something he gets hung up on, he doesn't hesitate to call and ask. When something, that the house doesn't understand and he can't explain, he calls me. And if I don't know the answer, I call Teresa. And if Teresa don't know the answer, she'll call 15 other people. We'll get them the answers they need. But if everything has gone into this bill the way that it has all been discussed and talked about, I think we're going to have a really solid program. I know they're trying to stay true to the 4 pillars of 65, which was ease of access, free market, low entry fees, and what was the fourth one? Somebody help me here. Ease of access, low entry fees, no license caps, and no THC caps.
That's it.
Let the people have what's coming. And we didn't have a home grow option in 65. It was never mentioned. And I know Mr. Blackwell has tried to get that in the bill. If it's still there, I don't know. I know that would be detrimental to so many people in Mississippi. It's Mississippi being one of the poorest states in the nation. I see no reason with not allowing a patient to grow their own medicine. They know what's going in it. They know what happened to it from day one to the day that they actually use their medicine. And people say, well, we don't want them doing this, we don't want them doing that. But here comes the same argument of alcohol. No medicinal value, nothing. I mean, it's alcohol. We have it on just about every corner. And here I am as a citizen of Mississippi. I can brew up to 5 gallons of moonshine at a time, or I can brew beer in my garage with no problem.
Right.
So I see no problem with me having a little closet in my house to supply myself with medicine. We all know what this medicine costs, and there's no insurance help with it. And, I don't know what they're going to put on as far as purchase limits, but, if they say we've heard the number of 2.5 ounces every 14 days, typically in other states, you're looking at anywhere from $175 to $300 an ounce.
Yes.
So if a patient needs 2.5 ounces every 2 weeks, they could theoretically spend $1,200 a month, $14,000 a year, with a state where the average median income for the household is only $39,000. That can get expensive.
It's huge. It's huge.
So with a person being able to have their plant count at the house and grow their own medicine, that relieves one of the financial burdens from being able to treat themselves. I think that is a very important thing. The free market and no license caps. If you put license caps on something, it does nothing but drive demand up because of supply, and therefore drives the price of medication up. And it would keep people from the state of Mississippi being able to enter into a program. sometimes caps are good. The last thing you want is people that start a business and then 3 or 4 years down the road, it's, there's the supply outweighs the demand, and then a lot of people go broke. So if they are going to put caps on it, wait 2 to 3 years, let the market level out, and then cap it. Don't try to cap it right out.
Well, that's a really good point, Zach, because here's what they don't know is where are you going to cap if you don't know what the industry is going to be? You have to know how many patients you're going to have, and there's no way for them to predict that without it being an existing market. So to try to make a decision that early on and limit accessibility, limit potentially the amount of product, that doesn't benefit, and it doesn't benefit the state, because if they don't have enough product, they don't get enough sales and they don't get enough taxes.
Yep.
Let's say that, everybody wins. And like Zach said, if it's something that needs to, if it's something you need to go back to, or you need to revisit, you have sessions every year. Why cut your foot off in the beginning? Why limit yourself? And not just that, why limit the competition? Because the more competition you have, the more diversity in products are going to exist. Because you might give a processing license, but you don't know what they're going to process. What if you end up with all the same product because you don't understand anything about, what different process exist?
Right. I mean, what if all the processors only make gummies? Then you'd have no concentrates or pre-rolls.
Exactly.
What about growers and genetics? Let's talk about that, because we all know that each plant has an individual molecular structure, and that molecular structure affects people differently. You're not, we start digging hardcore into the research of the plant, and we're going to talk about the medicinal benefits. Let's talk about the medicinal benefits, because every single strain has a different terpene profile, and those terpenes affect our bodies differently. Why would you limit the opportunity for diversity in product?
Exactly.
You wouldn't.
And that's the thing.
And that's going to come down to what we allow to happen, because our ballot initiative was struck down, and it won't be even beginning stages of being repaired until a regular session in January. So we really have a chance with this bill to save lots of patients a lot of suffering. So we have to get it right. We have a responsibility to get this right.
And I feel our legislators feel the same way. They have a responsibility to give us the most solid program that they can. And for all of them that we've been talking to, that is the general consensus from all of them. They want this to be as perfect as possible coming out of the gate. There will be things that are unforeseen that we won't know until this industry kicks off, but they are trying to do as much research and see where other states have gotten things wrong and fix that from the very beginning. And my hat's off to them for that.
Absolutely. I mean, I think that's one thing that cannot be stated enough is how far our legislators have come with their education on cannabis. Like you said, I mean, months ago, some of these senators and congresspeople or, House representatives had no idea what cannabis was, much less anything about patient needs or, business aspects of it. And they really have worked really hard to make sure that they listen to as many of our voices as possible. And we need to give credit where credit's due. Yes, there's going to be things that need to be fixed, but that's the benefit of it getting through this way versus 65, because 65, everything would have had to be gone back and voted on. You can't just change things. The way this bill will be with the legislators writing it, we can adjust things for every session. We can, if there's something else we see that we didn't foresee being an issue, and it is, we can bring that up.
Yes.
Hey, Amy, on the patient aspect of this, let me just bring this up, because we are talking about what we feel is priority in a bill.
Yes, ma'am.
Patient privacy is something that, I haven't seen discussed very much. And I know that you are actively involved in working with multiple patients. And, do you feel like patient privacy is something that we should really, really fight for? Because I know that here in
It's
Oklahoma, we had a few issues with, a few things that were passed legislatively that did infringe on our privacy. So what do you
it is
think
the
about
highest priority. It is the pinnacle priority of patient care, is that privacy. If we're giving it to you when you go to the hospital to get an appendectomy because your appendix is inflamed and you have to have it removed, you have protection. The exact same rules and laws need to be in place for cannabis patients. No other alternative is okay. I mean, we don't need, when you get stopped by a police officer, your driver's license automatically coming up and saying, hey, this person just left the dispensary 3 days ago. They bought X, X, and X. They're probably under the influence. All of those things, if you can't do it with opiates and things, benzos, then you shouldn't have to do that with cannabis, period.
Well, and that's another thing that has been brought up, because we had that situation here in our state, and there was actually an injunction filed so that was not enforced. And the reason why it wasn't enforced is because the licensing and the patient records was under the health department. The health department is funded by the federal government, and when the federal government is funding something, they have to adhere to federal law, which means HIPAA is
Yes.
very, very critical when it comes to patient protection.
And I agree with I know we haven't spoke about this together, but I've heard you speak about this, qualifying conditions, and why that should not be publicized that's a decision between you and your healthcare provider. Just like if you get put on an antidepressant, an anti-cholesterol medicine, a statin, all of those things are private information, and cannabis and your cannabis, medical cannabis, should fall under that same exact thing.
Most definitely. One of the arguments I heard from one of the legislators early on, because obviously they know I'm a big Second Amendment guy and right to bear arms and stuff, being in the business I've been in. They say, well, when we pull you over, we know if you have a concealed carry permit. I said, well, yeah, that's for the safety of your officer. I'm not going to out of my truck and beat you to death with an ounce of cannabis.
Right. Thank you. Yes.
Well, no, let's point this out, okay? Because there is a stigma that we continue to fight. And when you are fresh in an industry and you're fighting a stigma, I'm sorry, but I don't trust any police officer with what they're going to do with that information.
Can you say that louder for the people in the back?
As a female, that is a very scary feeling. I'm sorry, I don't trust them. I trust them with my medical information. I don't. I don't trust them with any information they could use against me for no reason.
Thank you. Mic drop. Boom.
Exactly. And going back to something you said before about legislators have changed their mind and they didn't understand. Teresa can tell you, in our first meeting with Mr. Blackwell, and I keep going back to this because it was a pretty pivotal moment in the way I have approached things over the last few months. He told us we couldn't have been met with, it was under 5 minutes. The first thing he told us was, you're not getting smokables. We're not going to have smoking. Nobody wants it. And we explained to him how smoking the cannabis was so important to so many different people. And by the time we left that meeting, we had just about changed his mind. And we have spoke to 6 or 7 other senators, and they brought up that smokables were in there, and they would have never thought that they saw it in there because, Blackwell and the health department and everybody was so against it. And Mr. Blackwell's response, well, I have been talking to some people and they educated me, and it is actually a fundamental part of using this medication. So just to have a guy tell us that right out of the gate and then want to learn and actually use that knowledge to benefit the bill and the patients speaks volumes. It
does. I agree.
I've grown to respect the man over the last few months. And it took me a while to get there because, as you all know, when this all started, Mr. Blackwell was the enemy. We wanted his head on a pike.
Yes, we did. We were going to take it too. No, I'm just kidding. I'm just kidding. I'm just kidding.
Amy, y'all two cannot be left alone. Like, I'm serious.
I'm just
Me and
kidding.
Bethany are just like, you guys, like, I feel like, no, really. No, seriously, you're right.
No,
Like, you
it's
did have a
wonderful
different
to really
attitude.
watch them learn and grow and watch them teach us things as well. They have reached out to us numerous times to educate themselves, but to offer their knowledge as well across multiple platforms. I mean, it's been incredible to see so many government officials working hand in hand with people like us who are representing a group of the public. We're about to reach our 15,000 member mark officially, which is a huge accomplishment for our group. And we are actually doing a membership drive right now to double our numbers by Mondays because there's power in numbers. And they're supporting us in this. They want people getting involved in their government, and it won't stop here because we have a responsibility to educate ourselves. And they want to help us do that, and they're wanting to educate themselves with our knowledge. So I really think hand in hand, Mississippi will be really living a historical year next year. I think it's going to be a great industry and really what this post-pandemic economy needs more than anything.
So Bethany, what is your priority as far as what you want to see in the bill? Because I know we've discussed a few things, and I know we're missing a few other things that I know are very important to you. So, why don't you bring that?
My top three, without question, smokables, because inhalants are the fastest effective medicine for me. Now, this isn't just because this is what I like to do. I moved out west for 7 years. You guys know this. If there was a cannabis product, I tried it. For me, with all of the conditions and my body and the response time and metabolizing rate of different options and ways to take things from ointments to edibles to inhalants, you name it. Smokables, just nice natural organic flower, is my best medicine. It's wonderful for me. It helps me be able to do little things like wash dishes, and then later on in the day still be able to play with my kid out in the yard. It really, throughout the day, microdosing inhalants has made a huge difference in my life. And then ointments are great for me too. I want to really brag on topicals and how wonderful they are. And usually how somebody gets into using cannabis is topicals. They kind of ease into it. So I always think those things are so important. So the reason I brought that up is because you said about processing. We need lots of different options for people so that they can really figure out what works for their body. There's so many different things we don't understand yet. And then, of course, home grow. It has been a very difficult journey to have to use cannabis. You guys made a point to bring up that insurance can't cover it. I've, over the years, sacrificed many, many things. Like I cut my own hair, I do my own eyebrows, little things like that. And it's been worth it because I got to have a daughter. I get to have a life. I'm doing things they never said I'd get to do. So those things are really, really my two big things. And then I want a right to my patient privacy because I want to be able to talk to my doctor just like I did when I was out west. My doctors were so supportive, and it was incredible to see that knowledge in a medical professional and their excitement to be able to tell you the things they learned about cannabis and to watch it work on you and to see their excitement. It was just a different environment. And a lot of you know that at 23 in this healthcare, and from 23 to 26, they pretty much counted me out. It was over for me. And when I moved out west, that changed. And it changed for the better. So that's what we're here doing for you guys now, is fighting for that, because we want that change in your life, for your loved ones, and for you, because this plant is saving people every day. Alcohol, like that you guys brought up, I mean, that is just at every corner. Cigarettes. I mean, I can just go on and on with all these dangerous, horrible, horrible things. We even know that sugar facilitates cancer growth. Yet, how many candy bars are on the shelf in the gas station? I can just go on and on with all these different things. And that's what we've tried to educate the legislators on. Look at the big picture in every aspect. Look at all the studies from where opioid and alcohol injuries on the job are actually going down in legal states. So on and so on. So that's really what we've done as activists, is become a voice of the people, but also a voice for cannabis education as a whole. And so I think these things are very important. And it's exactly what Amy said. We will continue to grow and educate, and they will continue to grow and educate us. But people have to get involved in their government. The days of sitting by and letting people make our decisions for our lives is over. You have to get involved. You can't just, it's not about just being behind a keyboard. You have to fight for your fellow man, and we're doing that. and it's incredible to watch Mississippi when we have such a bad reputation to really come together and fight.
Anthony, on the patient privacy, because I want to go back to
Yeah.
that. As much as I like to talk about education, let's remember here that we are talking about what we need on this bill and the patient privacy. This is where we're going to have to throw something very important back, okay? They have been stressing how the government should not be involved in our healthcare and making our healthcare decisions. What is pre-qualifying conditions? It is the government making a decision, a medical decision
about
that
your
a doctor
care.
should be making.
I mean, just in the news in the last week, you got our governor on there fighting with our president, which, you know, I'm all about free choice. You do what you want to do. But the government's telling us that we've got to have the COVID vaccine. We've got to have it. Any company that hires over 100 employees must enforce it or have a negative test every week. That is a prerequisite to having to have a vaccine passport in order to travel freely throughout your country. Since when did the government tell us what we needed to inject into our body? You know,
they have been telling us for 100 years we weren't allowed to ingest alcohol. Cannabis. There was prohibition on alcohol. The government overreach has been prominent for the last 100 years, and it really began with the Industrial Revolution, and that really changed everything. I mean, you got to think back to World War I, where hemp for your country. You had to grow hemp to help support your country at war, fighting for so many individuals in another country. It was a noble thing to do. And then now we sit here fighting for our right to this plant for the first time in history of man.
Yeah.
It is ridiculous. And we can't allow this to happen anymore.
All of our forefathers grew hemp.
Now you said you brought up gun rights already, right?
Yeah, that was one of the things in that first meeting where you and I were there. We
We
talked about it, and he was like, "Well, we can't do that." And I said, "Yes, sir, you can." And then you gave him the language out of you guys' bill from Oklahoma, and then I actually showed him where some things had been lifted through the NICS system, where they do the background checks for new firearm purchases. And he was taken aback by that because, I mean, we live in Mississippi.
What exactly changed on that? Can you be specific? Because I think that's really important.
They removed the question about marijuana from the 4473. A 4473 is the form you fill out when you're buying a new gun. When you're having a gun transferred to you, there was a question on there that said, were you an unlawful user or addicted to marijuana? And you had to answer that question. If you answered the question yes, you were automatically denied a firearm. So now they have removed that question from the 4473, since 32 or 33 states are now medical or recreational at some point. And we are really a stone's toss away from the federal government having to reclassify marijuana.
They're going to have to. They're absolutely going to have to.
And I think it was the Supreme Court actually came 2 or 3 weeks ago that said that the ATF and the DOJ is actually about one more lawsuit away from having to declassify it. They're getting tore up in court every which way. You know, a Schedule I substance is something that has no medicinal value at all, but yet our government holds 38 patents on cannabis for some type of medical reason or another. Where do you think Marinol comes from?
It's synthetic THC is what it is.
Yeah, we've been growing it legally at the University of Mississippi since the 60s.
Which I would also like to bring back up. The University of Mississippi School of Medicine still does not teach ECS science, yet has spent 50 years growing medical cannabis and sending it to patients in different states. That has happened
shameful.
Yes, very shameful.
Well, you and I, all of us, anybody with, I would say, half a brain in their body understands that there's going to be money somewhere, and if there is money, the federal government wants it. Even
they're not being very productive in doing anything with that.
Actually, to quote one of our legislators, Bethany and I spoke to the other night, the man, and I won't call any names, but it was hilarious when the gentleman told us. He said, to be quite frank, politicians do not know how to spend money. They piss it away. Because we were talking about the taxes, he said that, I don't feel as if we should tax this medicine at all. And I said, now I can understand that, but at some point, anybody with any kind of business experience understands in order to create new programs and new jobs, you have got to have revenue coming in from somewhere. Even in 65, we voted for a 7% tax. With that tax, we were going to fund the program and the program only. Now, I'm still good with a 7% tax, astronomically lower than any other state in the country. And fund the program. And like we were explaining to him, let's put the money back into education and infrastructure. He said the problem with that is that goes back into the general fund, and then it just gets, for lack of better terms, his words exactly, where it gets pissed away. If they will put in the bill exactly where it has to be earmarked, would be much better. And I don't think anyone in this state would not agree that we need education money and we need to fix for potholes. I've seen the signs at every rally. Our roads are some of the worst in the country. It's put the money where it go.
Yeah, I'm pretty
Absolutely.
sure one time when we had to go to Jackson, I think I died in a pothole once. I mean, I saw my life flash before my eyes when I hit it. It was massive.
I lost half my car last week in one right around the corner
My
from the
stomach's
house.
still over there. I left my
Man,
stomach.
I found one over here in my county, over here in Marshall County. I stopped on the side of the road and bass fished in it for about 30 minutes. I didn't catch but 3, but it was pretty good. I mean, we all know that there's some problems in this state that can be fixed, and this will be a huge revenue boost for our state. I mean, just to throw other numbers out, Illinois has been taunting just astronomical numbers for the last 6 months. Illinois in the last 6 months has consistently sold 120 to 125 million dollars in legal cannabis sales every month. And the state is getting anywhere from 22 to 25 million dollars in tax revenue coming back directly to the state just from cannabis sales. I don't know about you guys, but 20-something million dollars a month in the state of Mississippi can make
a lot of money.
And can make sure we get textbooks, raise teachers' pays, put more people out here on the road, fixing the stuff.
Take care of our veterans.
Yes, most definitely. That was one of the things that we heard the other day from one of our representatives that were writing the bill, that they did get a waiver in there for EMS responders and wounded vets or just vets in general?
Disabled veterans and disabled first responders.
Yes, that they will have all of their taxes waived. Which is I'm all about.
And their fees, I believe their card fees are waived, but we'll have to see what else they were able to get in there. That was just at that time. They had the card waived at that time for sure. I hadn't heard about the tax part yet.
Yeah, we don't know about the taxes.
And like I'm saying, if somebody doesn't stand up for their vets, then why are you even in America? Without them, we wouldn't have the rights we have. So, that's paying respect to the people that go out and make sure that we can continue to live with the freedoms that we have in our country, which I think we're the only country in the world that has the freedoms we do.
Are we missing anything else before we get on that? Because I feel like we're missing something. I don't want to forget, y'all. I don't want to forget, and I keep getting sidetracked. Did we get everything that we thought was priority?
One other thing that we haven't discussed was THC caps. And one thing I wanted to touch on about the THC caps and THC limits and why, as a patient, you would not want THC limits, because I'm not sure this is something that everyday people would know. So I just kind of want to put the reasoning out there. Cannabis is used for many different purposes medicinally, and because it's used for all those different purposes, each purpose has different dosages. So somebody that has a bone cancer diagnosis may not need as much cannabis as, somebody that just has fibromyalgia. I'm just pulling that out of the air. Excuse me, forgive me. I know fibromyalgia is horrible, but I'm just saying, every patient has different needs as far as their THC intake. So that's one thing that we really want to make sure is on the bill is no THC caps, because certain epileptic patients need higher THC, some don't need as much THC. So we kind of really need that whole availability there.
Talk about how that
And it
affects
comes back
cost
to your
as well,
doctors
since
being
cost
able
is
to
important.
medicate you.
Well, no,
if
let's talk about cost, because if you reduce the dosage, people have to pay more money to get more product in order to reach the dosage that they need. So cost is a huge factor in whenever you start capping THC. So that's another
Absolutely.
thing for patients.
especially when you start talking about something like RSO, which is used to treat brain cancer. Most recommended doses, which, you know, I lost my wife to brain cancer, so this is kind of one that I've studied up on in depth. She was taking a gram a day, which, you know, at 87 to 90% THC and RSO, if they're only wanting us to have 10% THC in a product, then I would have to buy 9 products to get her a daily dose.
It's 7
And that-
grams, 7 grams of product inside 1 gram of RSO is what it factors out to. So it's 7 times basically.
Exactly. But now if they limit it to 10% THC and I need 90%, that's nine edibles, 9 pills, 9 whatever it is. And then what all other carriers are in there with that RSO in order to get that percent down. And that was one of the questions that I was asked by one of the legislators that was working on the bill, because they were trying to understand milligrams and percents. That was that Sunday afternoon I called you. And the way we explained it is we all have a dog and we go to a vet and they give us a pill. Say that pill's 100% of the medicine, but the dog's not going to eat it. So what do? We shove it in a hot dog. Well, when we shove that pill in a hot dog, it knocked the percent down on the weight of what you're feeding the dog. You know, so they kind of understood that one, and I think they relieved that cap. And since they wanted to make sure no one was overdoing it or abusing the system, I think they may have put daily purchase limits on something. You know, allow the no THC caps, but what you are allowed to purchase daily.
Right. And that's understandable. And you know, there's going to be certain things we have to learn to work with and work around. And that's where somebody like Teresa's experience really comes in handy, because she's been in a multitude of states and she knows, okay, and not only has she worked on the grower side, but she's been on the patient side of it as well. So it just factors all of these people all bring a different piece into this to make it work. And it's really important that we're all here doing it. I'm proud of us, y'all.
Oh, it's been incredible. I mean, everybody has been amazing to work with. I'm so lucky to know you guys and everybody that's fighting this fight. A lot of big things are going to happen for sure over the next few days and definitely the next couple of weeks. So, I don't know. Is there anything else you guys want to tell everybody to be hopeful for, to look forward to? Anything else?
I keep thinking I'm missing something, and I don't think that I am.
Well,
But,
there's one other thing that I want to give credit to, and it's to our legislators. We have educated them on cannabis, and they have educated us on the legislative process.
I have learned so much this year, y'all. So much on the legislative process. Full stop. Everybody bugs us to run for office. No, if you if you only knew.
These guys go through so much trouble, not trouble, so many headaches, hit brick walls everywhere. But it's a process, and they must follow the process in order for everything to be right and legal. And unfortunately, those things take time. As we're seeing, we're months in. But if this bill comes out with just 75% of the stuff I've been told, we're going to be pleased. If we get 100% of it, I'll do cartwheels on Facebook Live, and that's going to be some funny stuff, I promise you.
No, we're getting you milk crates, Zach. That's it. We're getting you milk crates.
I got old bones. Oh, no. Man, I can't walk up steps without falling down half the time, y'all.
Hey, what percent do we need to do to get a somersault at least? What percent? I mean, here's my thought is I'm a little concerned about you doing a cartwheel. So like, let's start talking somersaults.
Cartwheel. I can do a cartwheel, somersault.
No, really. Hey, I'm trying to help you out here, buddy, because I think it's gonna go good.
Because old bones and all.
Yeah, and here's another thing that people need to know is that yes, we're hopeful, everybody's happy, but we have talked to all of our legislators and let them know that we are tired of waiting. We have been nice, we have worked with them, we have been patient, but we are 4 months past a strike down, a month past when we were supposed to have a program. And we've been hearing this week, maybe next week. And now we have finally heard the words we wanted to hear as we have got this thing wrapped up Monday and it's going to the governor's desk. The people that we're fighting for in this group and the people across the state need to understand that we are going to be patient for 1 more week. And if we don't have a definite date on a special session by the end of next week, then we're going to go ahead with our plan of action the week after and every week after session is called. And the legislatures have all asked us to not do that, give them 1 more week, and we're going to give them 1 more week. After 1 more week, if there's not a session being called, then it's time to take the fight to them. And
all bets are off.
And my thing is what do politicians not like?
Bad press, baby.
They do not like bad press. And with what we have planned, it's going to be career ending. So, we're not trying to bluff somebody into anything. We're not trying to threaten anybody. We're just telling you, we have asked, we have been patient. We're asking you to do your job. We have waited long enough. You guys are far enough along. Let's get this thing done. And if not, you're going to have to start seeing us every week and you're going to be on the news. And before it's over, you're going to hit national headlines. And then no one will forget who you are when it comes time to go to the ballot box.
Oh, I love to come back in on a mic drop.
That's absolutely right.
Loving that.
And all 4 of us.
Sorry, guys, my battery went dead. This is my 3rd show today.
But all of us know what we have planned, and we're all in agreement that this is the next step. We've talked to legislators about it. Some of them are on board saying, yes, that's exactly what you want to do if you do not get the actions that you're asking for by the end of next week. So we have support from our legislators with the fight that we are fixing to take to them. So it's one of the things we're going to sit back, we're going to be patient, and next Friday at 5 o'clock, if we don't have a definite date on a session, and we can even give them 2 or 3 weeks from now, but by next Friday, we need to have a solid date on when this session is going to happen. If we don't, you're fixing to have solid dates on when we are fixing to start ruining your careers.
Bet.
I mean,
sorry, Teresa, take my mic away.
I can't leave you guys alone sometimes. No, I mean, I have honestly, I have no fight in this. It's not my fight. What I will say is that I do have confidence that, we are going to get answers. And I believe that, the right thing's going to happen. Like I feel very strongly, and I don't think it's better for everyone if things just get resolved, and if we all just get some closure on this, and the people get their program, because I think that for the most part everybody has done a really, really good job of keeping the crowd contained.
Yeah. When this first started,
I think that as far as the amount of time that I have dedicated to the people of Mississippi and the overflow of messages and just conversations being had, and how many times I've dealt with everybody and the emotions that come attached to losing your program. Like, this has been a very, very emotional time. This has been very, very difficult. I know that at different times throughout this entire process, that every single one of you has had a moment where you have completely broken down, because this has been such a huge devastation and a huge crush of dreams. And hearing Bethany become overwhelmed and running this association and, you know, trying to juggle the different personalities and the different opinions and the different anger that's geared towards her because of the work that she's put forth. And Zach, for, you know, the hopes that you had in your business and how devastated you were. You know, I know that first night when this all happened, you know, we got really acquainted with each other, and that conversation, that was an
talked-
8-hour conversation.
No, we talked 14 hours that
It was
first
14
night.
it was a 14-hour conversation because we did not
14
sleep.
hour
We
conversation.
did not sleep the night after the Supreme Court ruling. And I know that for 14 hours, we were on the phone together. And Amy, there is not a day that goes by that you don't hear from your patients, the people that you've been fighting for, the people that you've been speaking to, the families that are worried that this isn't going to happen, and the action that people want to take and the anger that they feel and the lack of information. Like, all of those things and all of those emotions get wrapped up into so many different people, and when those people start coming together, you start to see change.
Yes, you do.
But I
And
don't,
it,
but I want you guys to really focus on this, because coming together in a peaceful protest to really speak out all of these things that, although they are expressed in anger, what they really are is frustration, sadness, just absolute exhaustion.
this is some
Your brains are,
heaviness.
has been a very, very enduring situation for all of you. And that is what I want people to understand, and not the backlash and the reaction of all of these emotions that have been built up in all of you. And I'm
Yes,
proud
we're
of you
all
guys. I'm proud of,
frustrated.
I want to tell you that I'm very, very proud of you guys, because I know how difficult it has been for each and every one of you.
Well,
Well, you have helped us so much. So many days you have walked us back from the cliff edge. You have held our hands. You have just listened at frustration and just really been a wonderful sounding board and absorbed so much of our emotion and frustration. So thank you to you cannot be stated enough as well, because none of this could happen without all of us doing that, pulling together and working together. And I'll tell you, just as much as Zach will, at the beginning of this, I would not have sat at a table with Kevin Blackwell. And I told you that from my words. I will not sit at a table Kevin Blackwell is at. And I had to eat that to get this done. We've all had to absorb different things. And Teresa, really, thank you for your expertise, for your knowledge, for your willingness to listen at all times of the night, all times of the morning. It's super appreciated. Thank you as never enough.
And I can tell you this, Teresa has jerked my chain several times to keep me from just running off and jumping off in some folks' ass. Because I don't play well with others when I get upset or when I feel like I'm being disrespected. And she's pretty much kept me in check, and it's been the right thing to do. You know, and I've learned from that, and I guess I'm getting soft in my old age. Wow.
No, we're just growing, man. This is growing. That's what this is.
Well,
No, you guys, you know, I saw something in all of you, and we wouldn't be sitting here having this conversation, and I wouldn't be putting the time that I put into if I didn't see greatness. So thank you guys, because all I did was make you be better you and really see your potential.
Well, we appreciate you seeing that in us, even though if we didn't see it in us from the beginning.
Amen. I still don't see it. I'm not going to see it. So
Girl,
thank
you are
you.
you are a rock star. I'm so proud of you guys, really.
Yes, you are.
Yeah, it's incredible. Sorry, guys. I'm back again.
Sorry, we didn't have like a sappy moment, but it just happened. It just happened, and I'm grateful.
I missed it. I'm so proud of you guys. Yeah, I fangirl you guys all the time. You guys are an incredible part of my life. Y'all know that.
We're so
right,
lucky to be able to do what we love, y'all.
Let's wrap this up, you guys, because I think we've really we've really shared a lot. This has been great. Like, you guys, I love you guys so much, really.
Hey,
Yes, thank y'all.
Bethany, change me back to host so I can download this and it's over with.
All right.
when you came back in, you took over.
Oh, well, I'm sorry about that.
Well, you were the one that
You know
called.
what?
But
Bethany's Bethany's
yeah,
an in charge girl all the
everybody
time,
is.
though. Yeah, no, you really done good at that, Bethany.
Yeah,
Oh,
I mean,
thank you. Thank you so much.
happier with the team that we have, and this isn't just all of our team. We talk to so many people from the group that give us so much insight, so many people that help, so many ideas, and so many people that are, if you need anything, call us and we will do our best to make it happen. And that's one of the things to where if we don't get our session by next week, I know we have 500 to 600 people that are ready to go from the tip to the bottom, from the east to the west. And we're going to do that every weekend till we get our session. And after this first one, when they see what happens and the backlash that falls out from it, they are going to be quick, fast, and in a hurry to call a session. If they're not, it's going to continue to get worse week after week after week after week.
Yep.
You know, these people are put in office to fulfill the will of the people. The people voted overwhelmingly for this program. It's time to give them their program. We are far enough along. They can go into a session, and whatever little minute details are left, they can fix it in just a few hours. And then they can get out and go on about to the next thing. It's not that hard. Let's get it
I
out.
agree.
You guys
Make
No,
it happen.
absolutely. And with a
doing
governor
it.
who is making it very clear that the government shouldn't be meddling in healthcare, his delay is speaking volumes. So I challenge him to be a man of his word and stand by what he is preaching to the choir and call
Time's
the
up,
session.
Tate. Special session now, sir.
Let's call it, Tate.
And here's the thing with Tate. We're not asking you to put them in session next Friday. We're asking you that by next Friday, you pick a date and stick to it.
Yeah.
You don't have to have everybody in there on Friday to get this bill done. If you can, that would be great. But if you can come out publicly and say, okay, we're far enough to have a special session, and schedule conflicting is going to allow everyone to be in Jackson on this date 2 or 3 weeks from now, as long as we know that we have that date, the people will be able to rest easier.
That's it. So many people's livelihoods wait on this, and I think that can't be stated enough. But yeah, we're approaching our time. So Bethany, anything else you want to say? Teresa, anything else you want to say?
No, I'm good.
I do want to point out that guys, tonight there is a mother that is watching their child seize in their bed in this state. There is someone holding the hand of a loved one that is battling cancer, that is throwing up and battling chemotherapy. That is happening in your state right now. As we sleep and go to bed with our healthy families, there are people out there getting ready to say goodbye to loved ones. Help ease their suffering. Get behind the fight. Stand with the 74 because it's our time. We have to fight for these people because a lot of them can't fight for themselves. So whatever you got to do, get behind, get involved. Any organization that's behind cannabis in the state of Mississippi, definitely reach out to any organization that you can get involved in. It's all about uniting for people and uniting for the patients of Mississippi. And that officially is the hype right now. And we thank you guys for coming out and watching it. And if you guys have any questions, reach out and we'll be back with a new episode next week, hopefully announcing a special session.
And
Thank you guys so much for watching.
Here's one more thing, Bethany. Today, I out to many of the other cannabis groups, the coalitions, these people, the this people, the that people. And when I explained our plans on what we were fixing to move forward with, if our special session is not called by Friday, you are going to see huge numbers of people that get behind our next move to get our session. And, you know, we've been working as We Are the 74, and we have kept good graces with these other coalitions and these other groups. But I talked to 7 or 8 different groups that are activists doing the same thing we are. And we do have minor differences on some things, but when it comes to getting a session called, all of those little beefs that we may have between each other are going to be set to the side. Everybody's going to come together, and it's not a matter of who gets the credit for it. Mississippians get the credit for it. And there's one thing politicians hate more than anything, and that is the fear of people united in their state.
Yes.
I mean, I have reached out to the Mississippi Cannabis Coalition. I have reached out to Shay Dobson with his pledge of Mississippi Minorities for Medical Marijuana. I've reached out to several of them, and everybody is on board for what we are about to bring down the pipe. And I don't think, there's 11 legislators that we have told what's happening, and we know that has trickled back up to the top. And it's one of the things of, you may not believe that it's coming, but if you don't do what you're going to do, it's most definitely coming. And I don't care if I have to stand up there by myself and be the martyr to make it happen. I'll do it.
Oh, don't worry. We have quite of an array of some known people that want to come out and join us in this. Maybe a celebrity or two that we're working on. No, we hope for the best. We plan, we try to work. We've done everything we can to be as involved as possible to help see this bill through. And we always prepare for the worst. We're not going to stop fighting till we get what we promised we were going to fight for.
That's right.
Can't stop, won't stop.
Exactly. So yeah, everybody, any cannabis organization you can get involved with, definitely. There's Mississippi Cannabis Coalition. We are the 74. The few others, Citizens Alliance of Mississippi, which is CAM, that's Shay Dobson's group with the pledge. Or there 3MA, MAACP, that's another one. Can you guys think of any that I missed?
Did you get the Cannabis Coalition?
Yeah, Mississippi Cannabis Coalition, that's huge. Ballot Initiative 77 supporters, follow that group. Follow them all, get involved with every one of them, because we're all trying to fight with each other and do this thing.
And I actually talked with David Singletary today, and he was all systems on board for our idea and said, count me in and let me know where I can help. And, we've had a rocky past with 77 trying to get passed without a ballot initiative process. We've had some arguing back and forth, but when it comes down to the end of it, everybody understands what's important, and we can set those differences aside and we can make it happen. And there's strength in numbers.
Yeah, and if we can all do it, there is no reason that the House, Senate, and our governor can't get on the same page. No excuse, because to have this many groups, this many organizations, you're talking about hundreds of thousands of people that are coming together to fight side by side. In a state like Mississippi, no one, that's why the entire country and the entire world is watching Mississippi right now. And that's because of its people and the fight that they're putting up. That's why they're watching. It's miraculous.
Well, I can tell you one thing about people from Mississippi. We ain't never scared of a fight. That's for dadgum sure. And, it's taken a long time to get to this point. I wanted to start fighting May 15th.
Let's go.
But, in order for things to happen, we have got to give them time to do their job. I think it's been an ample amount of time. So now's the time. I'm issuing an ultimatum. We want a definite date for a special session by this next Friday at 5:00. If not, get ready, because here we come to 10 courthouses across your state every weekend for at least 2 months. That way we don't have to schedule 1 4 or 5 hours from somebody. Anybody that wants to join a rally can be there in under an hour.
Yes.
We're going to start with the most heaviest population.
And all media has already
yes.
All the media has begun to be notified in those areas as well.
Yeah, I've already got all the media up here in the top part of the state coming out of Memphis to cover everything. I've actually got 4 different news crews here, and they're all going to be here at the same time. And the thing is, once this starts getting reported, if you have 5 or 6 different rallies that get picked up with really good stories, It's just a matter of shooting them things to national headlines. And when the national headlines and you have the whole country looking at you, you have no other option but to either make this bill happen or start packing your shit at the next election.
Do that anyway.
Well, I mean, you really say that because there's a lot of people that we would 4 months ago ready to kick out, but they have really stepped up and brought their A game to the table and have kept an open mind. And for those people, I have a lot of respect now.
Absolutely.
No, absolutely. I try to tell people all the time, like, we're asking, and we've been asking these people to stand up and do the right thing. So why are we dogging the ones that are?
Right.
So again, the bill comes out, that's the moment of truth. And until then, we can only be kind and respectful, because I try to explain to people, if I ran for office tomorrow, you couldn't hold me accountable for 20 years of the congressional districts not being fixed. I might be a freshman congressman who could actually get in there and actually change that. So we have people that are willing to step up and fight to change these things. Realize who your allies are and let the proof be in the pudding, so to speak. Watch their actions and let's see what this bill says, and then we go from there. But we always keep fighting no matter what.
Well, and here's another thing. How many legislators reached out to you and I, Bethany, that said when this session goes in and we get the bill passed, we all want to go out as a whole and celebrate. These legislatures are so ready to celebrate the passing of this bill, and we have worked hand in hand with them for months, that they want to share a dinner table and break bread with us and be able to actually rejoice that they were able to get something done the right way for everyone. And for legislators to want to meet you for a victory dinner, that lets you know they are as excited as we are to get this done. And
absolutely, and they are.
In all honesty, it's going to be a huge metaphorical group hug, and basically, at the end of the day, everybody's going to walk away happy. So let's just hope for good things. And I love you guys. Have a good night. And I can't thank you guys enough for your hard work. This is going to happen. I know it is. So.
Oh, for sure. Thank you guys again for watching. And anybody got anything else you want to drop in before we wrap it up?
I think we've said just about all we've had to say.
And then some.
And I mean, be politically correct. If we don't have that special session by next Thursday and you think we're going to lay idly by, you may feel free to test that assumption at your earliest convenience.
Next Friday, right? We're hoping he calls it officially by next Friday.
Yes,
yep.
By Friday. I'm not saying they got to go into session next Friday.
Exactly. They just need the call. The call needs to be.
We want a definitive date by next Friday of when this session is going to start. I don't think that's too much to ask. If they need 2 weeks after that to get everybody where they need to be in place to get this vote, because we all understand how hard it is to get schedules lined up for 174, 75 different people. But it can be done. We were told they were asked to clear their schedules for the second week of October and the second week of December. The second week of December has come and gone. October's looking like the next weekend that everybody's free to come. If that's the case and they're planning on calling it, let us know now. Give us a little bit of a win here and let us ease our concerns and let us rest a little easier knowing that this fight is in the final stages. And
absolutely. And it was second week of September. He's not talking about pushing it to December. Just wanted to make that not December, September.
I'm sorry.
That's okay. I just didn't want people to be like, what do you mean September special session? I mean, December special session. I was like, yeah, I want to make sure. They talked about September, that one passed. And then now we're looking for October.
Well, they had originally hoped to have the session the second weekend of December. but there still wasn't a solid consensus this past week. But now that after this week, and we get the information from Mr. Blackwell that says it's all but wrapped up, should be wrapped up Monday and on the desk. Him and Mr. Yancey have worked hard together, and they truly believe that they have a bill that no one will have a problem passing. And as soon as they finalize that paperwork and run it up the flagpole, it should end up on the governor's desk. And then all he has to do is say, well, these boys have done their work. They've got their consensus. Now I'm going to be a man of my world, and I'm fixed to give them a special session. And I don't care if it's 2 weeks out, 3 weeks out. Set the date so we have something to look forward to. Everybody that is in this fight and is an activist is tired of the unknown. Give us a deadline. Give us a time.
30 more days is too long. If October 14th comes, that's the 5th month. So we have to have this done now. 30 more days is too long. You've had 4 months. Like, come on, man. Like, we're here now, and we know that. And we know that within a week, there shouldn't be a problem calling it. So that's where the deadline comes in, because we, again, have talked to so many people, and we have missed the September week that had originally months ago been put on the calendar as an open space. So that looks like that leaves open the next available date, which was the 2nd week in October. We're hoping to double our numbers by Monday, and we are the 74, so that we can show the governor our access to people and how many people are willing to fight for this. So everybody make sure to go to our page, do the poll, so that the people and the legislators can see what you want in this bill and what's most important to you. Get active, get involved, and anything that we can do to help you guys with your journey in cannabis activism, please let us know. It's really important for us to educate you guys on as much as the stuff that we're doing, so that you can learn as well, and so that you can be the next big activist in Mississippi fighting alongside us.
And one of the people do not need to get lax on is every day from now until next Friday, or now until we get our special session, do not let up off of those phone calls. Call the governor's office. If you're sitting at home, you got a day off, call them every 15 minutes. That's what they're there for. Answer the phone. They will eventually get sick of you and give you what you want to go home. It's just like the toddler that keeps screaming, I want McDonald's, I want a Happy Meal, I want a Happy Meal, I want a Happy Meal, I want a Happy Meal. And what do you do to shut them up? You load them in the car, you take them down there to Ronald McDonald's, and you get them some chicken nuggets. And
Well, we will definitely hope for the best, and we will be back next week and do an update and kind of let everybody know what to look forward to, whether it be a 10 rally spread or a special session in the works. We will have one of those updates for you as soon as we can. You guys, thank you guys again for watching. Amy, Zach, thank you guys again for coming on. Teresa already had to go. Yeah, so that is the hype, and we're going to wrap this up, and we'll be back next time, and we will see you guys soon. Love you guys big.
Take care.
Bye, you guys too.
Love you guys.
Bye. Love y'all.
Bye.
Bye.